Good morning, everyone. Welcome to the public session of the Oversight and Engagement Board for the 22nd of October. The time is 5 to 10. Apologies for a slightly delayed start. I'm going to come straight on to the minutes from the previous public meeting, which was for the 16th of October 2020. I'm assuming that the minutes are okay with everyone. And I'll sign them off unless I see any hands up to the otherwise. So with quickly, we'll come on to item 11 on this agenda, which is the summary of the local surveillance data. And Lucy Whiteman, our Director of Public Health, will go through the data as always. Hi, Lucy.
Good morning. Thank you, Councillor Morris. So this is a summary of the data up to the 11th of October 2020. People will see obviously that we currently as a county have all our boroughs and districts in tier 1 of the government's COVID-19 alert systems. And although this demonstrates the fact that we have made significant progress since having 3 boroughs and districts on the Chief Medical Officer's watch list a few weeks ago, I fear that it may cause some complacency, and I think some of the data in this pack will demonstrate the fact that we are certainly not out of the woods at the moment. Our recommendations and our request is still that all residents adhere strictly to the national guidance. And indeed that they consider, just because they can do certain things under level 1 restrictions, whether they really should under the circumstances. And I'll go into a little bit more detail in the next few slides. So the first slide just gives you a summary of those new levels that the government has provided guidance around, and a link there if people need it to the full information. But locally, cases are still rising, and therefore on the next slide you'll see we're very concerned about household transmission, and we're asking for parents to be firm this half term and to make sure that obviously if they're going out, if they want to do things with their children, that they try and do so within their household group or their support bubble. There is evidence at the moment that some of our school outbreaks and increases in our case numbers in our younger age group are with socialising outside of school, and indeed things like sleepovers. So we're asking parents to be fair, as I said, this half term, and consider just because you can do those things, they are permitted to everyone, whether you really should be. I think if we move down to slide 8, please. This really clearly demonstrates why we're making these recommendations. So the number of cases in the week up to the 11th of October across the county was 701. So that is a significant and steep increase on last week, and obviously the week before. You can see the dramatic peak that is starting to happen in the graph to the left-hand side of the screen there. Overall, as a county, since the pandemic, we've now had over 6,300 cases. And it is a real concern, just not the numbers, but the steep and rapid increase that we're seeing week on week at the moment. We go down to the next slide, you can see as well that we still have that bulk of cases in the younger age group, so the 10 to 19 and 20 to 29 age group. But people will notice, if they've been watching these on a regular basis, that we've got a bulge now in our older age group. So cases are increasing in the over 60s, and there is a real concern that the current number of admissions in our acute hospitals is increasing, and the age group most affected is that over 60 age group. That may be to do with some caring responsibilities where parents, grandparents are looking after children. But obviously it does just demonstrate that we have got a significantly increased level of virus circulating in the community. And therefore, as I said, just because people can do things in level 1 doesn't mean that they should be. You can see the transmission really increasing here and across different age groups now. If we go to the next slide, this really demonstrates quite starkly that this is a county-wide issue now too. So where previously we had cases focused on our more deprived and more densely populated towns and boroughs and districts, you can now see that our more rural and our more affluent boroughs and districts are being affected here too. So we've had an increase in the number of cases in all boroughs and districts other than East Northamptonshire in the last 7 days up to the 11th of October. Clearly a very significant number in Northampton, and that obviously is to do with the size of the population there. But you can see there that no borough or district is immune. If we go to the next slide, we provide this as always as a rate. So it makes the different number of cases in each area comparable. So the rates at the moment, with data up to the 8th of October, apologies, you can see there Northampton has now gone to over 100 cases per 100,000 as a rolling weekly average. And we've got a number of boroughs and districts quite close behind that. Now that's a real concern. It is a red flag from a point of view of the national thresholds. But as I said, most worryingly, it's translating into cases being admitted into our hospitals. On the next slide, you can see really easily that visual representation of the increase across our boroughs and districts. Again, all boroughs and districts being affected. But what is worrying as well is that where we didn't seem to have obviously escalated at the beginning of September in the same way that other areas of the country had, we are clearly catching up with the England average, and that gap is actually starting to close in relation to some borough and district averages and the England average. The following slide gives us the summary of the position from a point of view of schools reopening and universities restarting. Data up to the week of the 12th of October shows that there are 10 outbreaks at that point, with 38 cases associated with those outbreaks. 16 cases have been reported within the student body at the University of Northampton, but we have maintained all schools at that point were open, with 93% attendance, which was only slightly down on that point in the previous year. So good news that schools are managing on the whole to operate, but concerning that we're seeing more outbreaks and then a higher number of cases per outbreak also in school settings. So slide 14 shows us again where we've got cases by community. So this is a crude number of cases and it shows the most affected wards in the county. People will notice obviously it's now starting to be a very dark picture from a point of view of heat mapping, so more than 15 cases in a number of our boroughs and districts. That's a 28-day picture. And again, if we look on the next slide, it compares it by rate, so makes each area more comparable, so you don't get clusters just where you've got larger towns. And you can see, as I was talking about earlier, this is now quite a distribution across the whole county. Some of those less affected areas at the beginning of the pandemic are starting to see a much greater number of cases. If we go down to slide 18, which gives a summary of the position from point of view of outbreaks across the county in the 28 days up to, I'm trying to look for the date on that, I think it is still the 11th of October. Just to be clear, this is not when we report 32 active outbreaks, these are not 32 new outbreaks. Outbreaks remain open for quite some time. They're only closed when there are no further cases for a 28-day period. So they can stay active on our system for quite some time. So this is not 32 in addition to last week's number. This is, the difference between last week's number and where we are now. Again, though, a picture that is clear is that we've got outbreaks across all boroughs and districts, focused more so in Northampton, where we've obviously got a more densely populated area and more businesses. But obviously care homes continue to be a feature because of the proactive swabbing. What is noticeable though is that we've got more cases per outbreak in care homes. Obviously our infection prevention and control teams, environmental health officers and adult social care providers and commissioners obviously continue to support that both proactively from a point of view of providing advice, guidance, PPE, etc., but also in response to any outbreak as well, make sure that everybody has what they need, has all the information and guidance they need, and that everybody associated with that particular outbreak is isolating appropriately. People will notice again that we've got that outbreak increase slightly in schools, and workplaces currently stand at 9. From a point of view of overall actions, I'm sure people will have seen a lot of the media work that we've been doing. I think some of the messages that we particularly want to reiterate are on slide 20. So when people are identified as a case, particularly if they live in shared accommodation, either with family or others, one of the most important factors that we found is people aren't isolating within a room within their household. They are circulating with the rest of their household members, and therefore we're seeing a large number of household clusters where a case is then transmitting that virus to other members of the household. So we're hoping that the graphics that we've developed and that are displayed here just remind people, obviously, if they do become a case, they need to isolate away from the other members of their household wherever possible. Try and use separate towels, separate cooking and washing utensils, wash those separately at a hot temperature. If they are having to use shared areas, to try and use them last, and then obviously clean with a dilute bleach solution, and that anybody within that household, so the case needs to be isolating for 10 days, anybody else within that household needs to be isolating away from the case for 14 days. So just want to reiterate some of those key messages, because as I said, we're still seeing that transmission between household members, and then obviously keeping any contact between households at a minimum as well. So if anybody is asymptomatic but is a case, we're reducing the likelihood of them infecting other households as well. I stop there, Councillor Morris. Thank you.
Thank you very much, Lucy. A very good summary of the data as always. I'm looking around the room. Councillor Phil Bignell has a question, and then Toby Sanders wants to join the conversation. Phil.
Yeah, just a quick one. In terms of communication, we're coming up to half term, and it's obviously an important break for various reasons, but as a communication forum, could we not send a letter to all head teachers of all schools to disseminate through their parent network that says, no, don't have sleepovers, don't do this, don't do that, as a message, and use them as a targeted audience to actually, because we could just contact all the head teachers of all the schools in the county. That may be a way of getting that information out there to protect that particular cohort.
I'm happy to take that as an action. Absolutely. Although we've done the graphics, we haven't contacted schools individually, and I'm happy to take that as an action. And Councillor Bignell.
Thank you, Lucy.
Very good idea, and we have obviously written to headmasters and governors and etc. previously, so probably something that we know how to do very well. Toby, can I bring you in? Oh, you're still muted, Toby.
Apologies, Chair. I'd just like to add a little bit of NHS detail to reinforce some of those important messages there from Lucy. Lucy made reference to the increasing numbers of acute hospital admissions that are COVID related, and I wanted to be able to share that at the moment, as of yesterday, across our 2 acute hospitals in Northamptonshire, so Kettering and Northampton, we had 38 patients in those 2 acute hospitals that were COVID positive, with a number of other query COVID positive patients. And whilst that number sounds small, and as a relative proportion of our overall hospital bed base, it remains thankfully still relatively small. 2 things I think are important for us all to note. First is the rate at which that's been increasing over recent weeks. So in direct response, and a couple of weeks after those overall larger numbers going up from a community perspective that Lucy's made reference to, we've seen the numbers stepping up quite significantly and doubling and trebling. So during the course of August, we were typically seeing single figure numbers, 5, 6, 7, 8 across the 2 acute hospital sites. So the rate at which that steps up to that 38 number yesterday is a cause for concern from an NHS perspective. And that's not that we don't have the capacity at the moment to be able to cope and support our patients and local population at this point. The real risk at the moment for the NHS locally is that as those numbers start to increase, we run the risk of starting to have to reduce other services that we've been working really hard with our staff over the summer to get back in place. So lots of other non-COVID related services, elective treatments, day case work, diagnostics, outpatient work, really critical to other aspects of people's health and well-being that we want to be able to continue to support and provide for our local population. And it's that balance that is the risk as we go into autumn and winter. So just from my perspective and from my NHS colleagues, really would reinforce and urge people to listen to those important messages from Lucy and do everything we can to try and minimise the further spread of the virus across the county, to enable us not just to support those people who need care and treatment support when they have COVID, but to be able to keep those other really critical services that are non-COVID running for as long as we can through this autumn and winter. Thank you, Chair.
Thank you very much, Toby. And I think we'd all echo those sentiments. It is team effort and teamwork across the piece that has so far although the numbers are going up in Northamptonshire, I think the work that's been going on amongst the people of Northamptonshire has been very impressive. We just need to keep that going for some time to come, unfortunately, but I think we can do it. So yeah, brilliant, good messaging there, Toby. David Jones from Health Watch, I wanted to bring you in.
2 quick points. Firstly, building on what Toby has just said, I think at the moment there are concerns about people who have other health worries who have not sought help. And it's around health, cancer issues, or and heart conditions and all these sorts of things. So I think the message is that if you're worried about your health, do seek advice. Don't hesitate, don't wait, because the consequence of waiting could be very serious, and that also is a pressure. So it is actually responsible to seek help about health problems, even if they're not COVID. And I know from myself, having recently had injections that for flu, that the surgeries are safe places to go to, and there's phone messages and so on. So that's one message. The second thing, a question to Lucy, I totally agree about the importance of self-isolation. People living in multi-occupied houses and students and others are in really difficult situations around how to actually put that in place. Is there any advice for people who are in multi-occupied houses or who can't self-isolate away in that sort of way? Thank you.
Lucy.
Yeah, absolutely. We do recognise that, and obviously it was one of the features of the Green Corps outbreak as well. So we're really mindful of the fact that not everybody lives in a large house where they've got ensuite bathrooms and those kinds of things. There are lots of arrangements where you've got shared facilities, and although it will feel like an arduous task, it will make such a difference if, as I said before, people who are the case are able to utilise any shared spaces last. So even if you end up having to pull together a little rota, it means that the person who's potentially infected uses the kitchen last, uses the bathroom last, is able to then wash down the sides, maintain their distance from everybody else. But a basic chlorine bleach solution is the best way to get rid of COVID. Hand washing is always one of the most effective ways of reducing the onward spread of any virus. But utilising those shared spaces last gives an opportunity for that cleaning to happen, but also for that space to then be aired appropriately. So it may sound like a very basic measure, but those things make all the difference.
Ian, I think people are feeling frustrated and irritated by all these little bits and pieces. And I find it myself. I mean, let's be honest, we're all of us just so frustrated by this. But following that advice will make a difference, and it's even worse to feel frustrated and then to feel really sick. So we've got to live with our frustrations and try and follow that advice. But it is tough. It really is. We're asking a lot of people, but it's worth it at the moment, I think. And thanks for all the strategy. We're doing the right things.
Thank you very much, David. I think, again, we all echo those sentiments. Can I bring, and talking about operating in the new normal, we're going to have a quick update on Halloween and Bonfire Night, which is going to be obviously looming large and is going to be obviously very important that messaging is put out around that. So I'm going to come to Lucy on that, if I may. Lucy, if you could give us a quick update on what the latest guidance is, obviously working with the police and all that, and the fire authority and every other party that's involved with that. Lucy.
Yeah, absolutely, Councillor Marshall. Right, this is a multi-agency approach, and we're trying to obviously make sure we've got one set of communications and one strategy for the whole county. Obviously, there are risks around Bonfire Night and Fireworks Night anyway, and this is why the fire service lead on these comms usually. So I'm the deputy in this respect. But what we're asking people to do for Halloween is, if they do want to still go trick-or-treating with their children, absolutely, children can dress up. Absolutely, the parents or the people within the support bubble can take their children out. We're asking residents, rather than to encourage actual door knocking and trick-or-treating, for them to put lights or carved pumpkins in their windows. And whenever a child sees one of those, for the parent that they're out with to give them the treat. So that there's no door knocking involved, there's no handing over of sweets from one household to another. So we're just reducing any potential contact between different households, but it still allows children to go out and have some fun. Similarly, with Fireworks Night, I think there is a significantly reduced number of organised events, some of which are drive-through or sort of, to view from your car, which, obviously we're happy to support, and fire and police also. What we are concerned about is people trying to choose to do small displays or have small bonfires within their own back gardens. Obviously, that poses a significant fire risk. But also, obviously, there still is a likelihood that people will invite people over, and we're still reinforcing that message that although there's a rule of 6 for areas with level 1, with increasing case numbers, as we've discussed this morning, just because you can do that doesn't mean that you should. So people will see a real increase in the communications and the media messaging around a safe bonfire and Halloween coming out this next week.
Thank you very much, Lucy. And I suspect we'll hear a bit more about that probably tomorrow at the press conference, which starts at around 3 o'clock, where we will have the police and the fire representatives there, very much showing the joint working that's going on behind the scenes on this. And I'm sure our comms team will update us shortly as well as to what they're doing in the background, or not in the background, as it were, in public ground. Okay, so we'll move on to a testing update from Sharon Wright. Hello, Sharon.
Good morning, everybody. So good morning, everybody. So from a testing perspective, the capacity in the laboratories to undertake the testing is improving day on day. And in light of this, we have plenty of capacity across our testing sites across Northamptonshire. So just as a reminder, we've got a regional testing site in Kettering, and we've got local testing sites as walk-ins throughout in Wellingborough, Corby, Kettering and Northampton. Just as a note, the Northampton one is likely to move in the next 2 to 3 weeks to make way for the Christmas market to go on to the square there. So we are looking at moving that to a different site in somewhere in the Northampton town, and I can update more once we've had some further conversations with DHSC on that. And then we have our 2 roving mobile testing units, which at the moment we have got one on Brack Mills and we have got one still on the university campus, and they are drive-throughs. So we've got plenty of testing capacity in the county, and there should be appointments available for anybody that needs one for the if not on the same day, for the following day. And I'll take any questions.
Thank you, Sharon. If I could ask a quick question about the lab capacity, if I may, and the
Yep.
resolution around that issue, because it was never an issue of appointments, it was more around the lab complex.
Yep.
If you could give us a little update on that, that would be very helpful. Thank you, Sharon.
We've had some. There's a raft of lighthouse labs, which are the labs that undertake the swab testing for COVID-19, and there has been a raft of those that have come online over the last 4 or 5 weeks, and that has enabled us to maintain testing capacity. And of course, we've also looked at having our 2 acute trusts in county to support any testing, and there is still availability for us to stand up a local solution to support key workers, health and our partners in blue light and social care to be able to get priority testing, but we haven't had to stand that up as yet. I think I've just booked 1 appointment since then, so that just shows that people are maintaining getting appointments into the system. The results coming back we were seeing about a delay up to about 7 days, but that is now down to a 3-day turnaround, and we're hoping that as the capacity sorts itself out and they pick up on the backlog, that will come back down to the 24 to 48 hours turnaround. But it's a lot better than where we were 4 or 5 weeks ago.
Sharon, thank you very much. And that just shows you all the work that's been going in behind the scenes from public health and ourselves in the county as well to make sure we have the capacity. So that's brilliant news. So tests are not a problem. That's the point. Everyone should get tested should they require one. Thank you, Sharon. I'm coming on to contact tracing update. Are you doing that, Lucy, or have we got,
I am indeed, and there's a couple of slides which I'm hoping Cheryl will be able to share with you. So people will remember that we took on local contact tracing a couple of months ago now, and that has started to make a significant impact on our ability to follow our cases up. So I'm just hoping that Cheryl will be able to share those slides. So I'll start to talk over some of the key headlines at the moment. So as of the 20th of October, 79% of all cases in Northamptonshire have been successfully contact traced, either by the national team or the local team. So that's increased from 69% the week before the local contact tracing went live. So you can see it makes a difference there. So you can see the contact tracing success over time. We've still got some way to catch up with some of our other areas, but you will see some of the barriers that we still face as we go through this presentation. So referrals to the local team on the next slide just shows that, obviously in line with the fact that our overall number of cases is increasing week on week, the number of cases that get transferred over to the local team to follow up on also increases. So we see now approximately 30% of all of the cases that are confirmed in Northamptonshire. It means that obviously the national system quite rightly is dealing with the lion's share and they're getting in contact in the first 24 hours. But that 30% would have typically been lost to follow up before the local team was put in place. And you can see the numbers there are starting to increase significantly, with over 100 being followed up per week for the last 4 weeks. From a point of view of the performance of the local contact tracing team, on the next slide, it shows you a breakdown of where we're successful and where we still have some barriers. So 603 successful telephone contacts have been made since go live. And of those, 455 have provided full contact tracing details. 20% have not been able to be reached by telephone or through door knocking, because that's one of the other benefits locally, is we're able to mobilise our EHOs to actually follow people physically. Now, sometimes that's because we've got incorrect details. Obviously, the most worrying outcome is that it could be that they are a case and indeed they're not actually at home. So we're still exploring what other ways we have of trying to follow up with people. Of those that are contact traced, some are still duplicates. So you can see here that resident claims or completion already is about 9%. So there is still some data quality issues coming through from the main team. But we've got a sort of a static percentage, around 8% of people who just point blank refuse to engage with this process. So you can see that 63 people that would not refuse to provide any details of who they'd been in contact with, despite the fact that they'd had a confirmed COVID positive test. So that is still a worry. We still obviously provide a letter that states the reasons why follow-up is so important. And obviously we try and enforce and educate wherever we can that this is one of the most important approaches to stopping the onward spread, but clearly we still have some challenges. And then obviously you can see there we've still got an inability, even with the right data, to actually get hold of that case in the first place. But I'm sure people will appreciate this as an improving picture, both an improvement on the national success by having local contact tracers, but also our local performance is improving too. Just to make people aware, if we go on to the last slide, it's got some headlines. We obviously are increasing the number of cases that are being sent through to us. So we have made sure that we have appropriate capacity in the customer service centre. And I wanted to say thank you to all those that are supporting the local contact tracing service, both the customer service centre employees, as well as our trainee dentists and our supporting independence programme staff. You know, without them, we would be losing the potential follow-up to a vast greater number than we are now. Data quality issues, as I said, continue to be a challenge. We escalate those. And, you know, one of the core issues has been, for example, where we've been notified of a case and they're registered to Northampton, but they may be a student elsewhere. So making sure that we're still able to follow up appropriately can be quite challenging when the address details are incorrect. But just to make the public aware as well that there is a new self-service offer being implemented and introduced by Public Health England. So cases will be sent a link to be notified that they are a case and that their test has come back positive, and they'll be given a link to a web form which will be live for 8 hours after that notification arrives, so that they can fill in the details of anybody they've been in contact with, and that negates the need obviously for them to have that phone call, and they're able to do that at their leisure, obviously within the first 8 hours. After 8 hours, that form closes and the national team will, for 24 hours, attempt to make contact with that person if they have not completed that form. After that 24-hour period, we will still get that local intelligence about who else needs to be followed up. So there's now going to be a sort of a 3-stage process, but it just gives the public a little bit more flexibility and control over that initial contact tracing detail provision with that web form. So that's good news, but that's being trialled over the next couple of weeks.
Thank you very much, Lucy. Very useful information on the contact tracing. I would urge everyone who's listening, watching, that if they are contacted by the service, that they should do the right thing and provide the information that they're asked to provide. I think it really is tantamount to, it's incumbent on all of us to do these things. It's not some sort of data sharing situation, it's to help suppress the virus. So I would urge everyone to get involved with that if they get a call from the service. I've got Ruth Groom with a question. Hi, Ruth.
Yes, thank you, Chairman. If somebody refuses to cooperate with the system without good reason, is there any enforcement that can be done? Because I mean, it's a tremendous act of selfishness just to refuse without good reason, and I just wonder if there's anything that can be done about that. Thank you, Chairman.
Thank you, Ruth. Lucy.
So at the moment, there's no legislation for us to make it compulsory to provide that information. Obviously, legislation now exists to enforce that person to self-isolate themselves as a case, but there is no requirement by law for them to provide the details of their contacts. As you quite rightly say, though, people need to reflect on the risk that they potentially are exposing people they may have been in contact with. Those people could be completely unaware of the fact that they've come into contact with a case and could be at significant risk. So as Councillor Morris says, I'd encourage everybody to be providing that information. We use it for no other purpose other than trying to make people aware of the fact that they could potentially have been exposed and to encourage them also to self-isolate.
Thank you very much. Yeah, very good point made there. 63 people you referred to, we're not trying to demonize those 63 people, but they could have caused a significant spread of the disease if they hadn't, as a result of not giving their information. So I think it's up to all of us to keep reaffirming that message. Thank you, Lucy. I've got Claire Hughes now with a comms update. Claire, hi.
Good morning, everybody.
Morning.
Okay, just to give you then an update on what we've been doing regarding messaging and communications. We're continuing with our daily messaging on testing, as we've mentioned before. We've also been promoting information on what the new tier levels mean in terms of what restrictions are in place and how people should be behaving. We have banners in place on the outside of primary and secondary schools to prompt social distancing behaviour at points of pick-up and drop-off. And we have produced 2 printed flyers that are also communicated digitally. These are being distributed by our colleagues in district and boroughs via our engagement cell. And a press release has also been issued on Monday to raise awareness about the support that is available. Now, one of those leaflets is about what to do and what support's available on self-isolating. And again, Lucy's talked about that a little bit earlier. And the second was to do with support available for sole traders. I think the sort of the phrase "be firm this half term" and avoiding avoidable contact where possible is kind of the key driver to our messages. We've seen, as I said, as has been said earlier, things like sleepovers outside of school, and really some of this this contact is avoidable. So our messages are all about the campaign. Just because you can, you know, you don't need to, and you shouldn't. Given the noticeable increase in older people, in the COVID cases, the 50 to 59-year-olds and 60s and above, we've created some additional social media messaging and images to remind families of how to minimise transmission through their behaviour, both inter and intra-family socialisation, so that we can change behaviour, hopefully, adapt behaviour and have safe COVID practices. We've been working quickly to develop some radio ads, which are targeted at different family social scenes and activities. This is all in the lead up to half term, where we know that a lot of people start to go out and do things as family groups. So trying to dissuade them from perhaps doing what they might normally do at half term and changing their behaviour to make sure that they are socially distancing and adhering to safe practice and minimising transmission. We've also been working alongside police and fire partners to join up our messaging to deliver advice and clear calls to action around Halloween, trick or treat night and bonfire night, things like that. Again, just let's just all think about what we're doing and can we do it differently and can we do it safely. We've also been working with the University of Northampton, and we're quite lucky. We've had quite a good response from the students who've responded to a brief to look at how we can engage with students on this messaging. We're still reviewing that, but they've been very creative with their video. So I'm hoping that that will be something that we can share through our YouTube channels and our social media. And we're currently reviewing those to see how we can develop them further. We're also planning a video with Lucy, because Lucy kind of is the fountain of a lot of knowledge there and has access to the latest the data. So hopefully we'll try and do some myth busting. We're going to be inviting anybody to use our social media channels if they've got any questions or anything that they're uncertain of. We'll put those to Lucy and then we'll be able to video that and play that back again. Hopefully it'll be a little bit more engaging than just a dry text Q&A. Excuse me. Yesterday, we were shared by the NHS a long COVID video, which I'm sure if some people have seen, it has some very impactful messages in there. And we are going to be adding that to our messaging in terms of our channels and promoting that. But I do think it's got some very powerful messages to counter the "it won't happen to me" perhaps behaviour that we're seeing. In terms of businesses, we've issued, as I say, a sole trader flyer this week, and following recent statistics that we're looking at is how we can work up some business focused communication and assets to support them. We're looking to support the sort of possibly announcements that are coming out on support available to businesses, and we're developing a second animation to the initial John animation which we produced. And that will be really featuring how great behaviour or better behaviour is undertaken in terms of like retail outlets going in to get takeaways, putting your mask on, social distancing at bus stops. We've also seen some issues and some hotspots where perhaps we haven't had the behaviour we'd like to see, of people crowding and not keeping those social distances at bus stops. At key points. So again, just trying to use animation to pick up some of those key messages in an engaging way. We've also got the results in now from our various focus groups and surveys that we've been conducting, and we're looking at what those key messages and feedback is so that we can develop communications to support that. Just simple little things as suggestions like having window stickers on buses to allow people to understand why people are wanting windows open to keep places aired, etc. We're looking also at a sort of an out-of-home product in terms of using digital signage, digital graphics and displays, which are transportable and highly targeted. So again, just moving that around our county, trying to get people's attention. As I say, we might be piloting that over in the next couple of weeks, but watch the space. It's certainly material and assets that other councils have been using to some good effect. So we're looking to see where we can implement those on feedback, based with feedback we're getting. We've generally now got a 3-week forward plan. So we're covering all of the scenarios that we come. We're horizon scanning as well. We're also aware that, you know, we're in this our current tier, things may change. So we're looking to prepare for any adapting of those messages as we go forward as the situation changes. I think that's the update. Thank you.
Thank you, Claire, for that very, very detailed update. I have to say, I'm always in awe of the comms team when they detail every week what they're doing. Thank you to you and thank you to your team. You really are doing an amazing job and keeping the comms messaging going out very clearly to the people of Northamptonshire. So thank you. I did want to ask very quickly, one very quick question. On the survey, did you have the numbers of the people who had responded to that in the end?
On the one survey that we ran, it was over, I think it was definitely over 2,500 people. Yeah, and there were some interesting little snippets in there, as I said, that there's always little golden nuggets to find in responses and things that perhaps where we don't look at things a certain way. So that's what we're trying to dig out and ensure that we use the right tone of voice as well as the right channels, And we do know that there is message fatigue, and we know that there's a lot of messages out there. So I think that's another reason why we're driving a plan, so that we get a good balance and we know where we're targeting our messages into who. It's not good enough to just be putting out messages blandly to everyone, because they won't get through.
Thank you very much. Thank you, Claire. Really impressive. So are there any questions? I don't see any hands up. No. So we'll come on future meeting dates. We've got, well, I'll just do any other business quickly before that. Lucy, did you have any other business? Anyone else? No, good. Thank you. So the future meeting dates are the 29th of October at 3 p.m, the 5th of November at 8:30 a.m, the 12th of November at 8:30 a.m, and the 19th of November, 8:30 a.m. We've decided to keep these weekly, these meetings, because we decided that everything moves so fast that it's important that we have them on a weekly basis. But should that change, although I don't anticipate it changing, then obviously we'll come back to the board to change the frequency. But at the moment, I think we need to have these meetings on a weekly basis, at which point I will close the meeting. Thank you very much for everyone for attending. Hope you have a lovely day, and I'll see you soon. Take care.